Joining us today is Professor Peter Brooks, Director of the Australian Health Workforce Institute, who will be speaking at IIR's Clinical Training and Workforce Planning Summit 2010, taking place on the 31st of August to 1st of September in Melbourne. Hello Peter, nice for you to join us today.
How are you, James?
First of all, what are the key issues currently facing the nursing workforce in Australia?
Well, I think there are many, but they're, of course, not different from what's happening around the world. We're seeing an increasing need for health workers in general, but nurses in particular, because they're one of the largest, if not the largest group within the professional health workforce. And there's an increasing need for health workers. The health workers themselves are ageing, and so we need to be thinking of smarter ways of recruiting people and retaining people in the system.
And how many new healthcare workers do we need to maintain an efficient health system?
Nobody really knows that answer, and people spend a lot of time working on the number of people that are required. I think it's much more important to look at the sorts of things that we might need to deliver health-wise in the next 10 years, and then think carefully about who might deliver those services and where they might be delivered. We've seen a tremendous change in health practice and move away from everybody turning up at outpatients or in a hospital. A lot of procedures now are done on a day basis, so they don't even require admission to hospital. So there have been lots of things like that. But looking at the ageing population, the population with chronic disease, and the fact that everybody is demanding more of their healthcare worker, we probably need to recruit in Australia about 500,000 or 600,000 health workers in the next decade. I say that because we've got the health and welfare workforce is now the largest sector of the Australian market, 1.3 million people. And the health budget is set to double from $100 billion to $200 billion over the next 10 years. And because health is so human resource intensive, a lot of that extra money will go on the health workers, and we'll need to recruit them.
And what strategies and facilities do we need to effectively recruit and train these new nurses and doctors?
We have to think much smarter about who we're training. We have to say, what are the things that current health professionals do, whether it's doctors or nurses, and ask, are there other people that we could train to do those tasks? We might be able to train them more rapidly, and I'll mention how we might do that in a minute. But we might be able to train them in 1 year rather than in 3 years, and have them coming out as, say, nursing assistants, or enrolled nurses rather than necessarily registered nurses. And I think they're the sorts of issues that we've got to look at. It's always very difficult for groups, particularly in healthcare, to give up tasks. We're still very much siloed in terms of healthcare, how we deliver healthcare. We don't tend to work all that well as parts of a team, and we've got to do that better.
Can you explain the hidden workforce and how we can utilise them?
Yeah, the hidden workforce is well, there are two parts of the hidden workforce. One is those people who are probably in their 50s, 60s, and perhaps now even 70s, who are actually thinking of either quitting completely, and retiring. And we need to think of some smart ways of getting them back into the workforce, not necessarily on a full-time basis, but there are things that we can do there, for example, using some of the new technologies for telemedicine, teleconsulting, that we believe could be used very well to keep these people in the workforce, even working from home, where they could be linked into, they could be doing tasks that don't necessarily require face-to-face contact. They could be advising They could be reviewing drug charts, for example, medications. They could be giving patients advice on medications. They could be giving, as we already have now, we have nurse hotlines and things like that try and triage people before they actually have an interaction with the system. A lot of that stuff could actually be done from people's home. There's also another group of people who take, particularly women who take time off to have their kids, either during the birthing process when they're pregnant or just afterwards. Now, a lot of them, we believe, would be quite happy to work 1 or 2 days a week, but again, variable hours. But again, doing things that they could quite probably do from their home, not necessarily, as I said before, having an interaction with patients. So there's quite a big hidden workforce there. There's also, of course, a very large group of carers. There are about 2.5 million carers in Australia, or people who are registered as carers. And obviously not all of them are full-time, but many of them need to be, or could be, probably better utilised if they were trained and one could look at ways of articulating them into already existing career pathways in healthcare.
You're speaking at IIR's Clinical Training and Workforce Planning Summit, taking place on the 31st of August to the 1st of September 2010 in Melbourne. What will you be addressing in your presentation?
Well, I'll be talking about some of the things we've already discussed, things such as what are likely the requirements for nurses, for the nursing workforce in Australia and overseas, because remember that we're part of a much larger health workforce shortage in the world, which is estimated to be about 4.6 million in this decade alone. I'll be talking about new ways of training health workers, particularly nurses, using simulations rather than necessarily patients, and looking at the mix between simulation and live patients. And I'll be looking at things that we might be doing better to recruit and retain nurses in the health system.
And finally, how important do you believe events like this are for the industry?
Well, this is the biggest game in town, I would have thought. I mean, the health industry is enormous. It's the most rapidly growing sector. People have an insatiable desire for health, so it's never actually going to go away. And I think the industry, the industry plays a very important role, whether it's the private industry or the public industry, whether it's recruiters, but it's really important to when one's running these sort of conferences that you've got the opportunity to interact right across the spectrum.
Peter Brooks, thank you very much for your time today.
Thank you.